Hello, my name is Michelle Nostadi, and I'm the Executive Director at the American Heart Association in Richmond. And we're so excited that you have joined us for this infant CPR demonstration. We are excited to partner up with the Richmond Ambulance Authority, and one of their paramedics, who is a great trainer, Harold Mayfield, is going to walk us through today how to do infant CPR and also what to do if an infant is choking. This, of course, is a demonstration, so it's not a certification training. But if you're interested in being certified, you can go to heart.org/CPR, and you'll put in your zip code and find the training centers that are near you and what their schedule looks like so that you can do that. But this is a great video for expectant and new parents, but also if there are people in your life that you can refer to this video that are around infants a lot, maybe grandparents or caregivers, that might really enjoy getting to walk through those steps and getting more comfortable with what to do in an emergency. So with no further ado, I'm going to pass it off to Harold Mayfield for the demonstration, and thanks again for joining us today.
My name is Harold Mayfield. I'm the training coordinator at Richmond Ambulance Authority. Today we're going to talk about infants and CPR. So just like adults, 9 times out of 10, it's going to happen at home. It's not going to be in the hospital. Therefore, you need to be prepared and know how to protect your loved ones. So first thing we always watch with a child is, how are they acting? We use a scale, and we have different assessments that we use to know the child's condition. So the first thing is going to be how do they appear? Are they lethargic, or are they overly sleepy? Are they excited, moving around? So that gives us a lot of information on how the child is at that moment. The other thing is their skin appearance. Is it dark? Is it light? These are different things that you see to know something's wrong or not. So if you come across a child who's lethargic or not moving much at all, and they're pale, well, that's going to let you know something is wrong. So therefore, that's when you might need to know CPR or at least how to remove a choking hazard. Children mostly suffer from cardiac arrest due to a congenital defect. It is very unlikely that a child's nice, strong, new heart is just going to stop working. So normally it's either that, or it's going to be from the fact of it starts off as something happening with choking or an airway obstruction. The leading cause of infant death is actually an airway obstruction. So the first thing that we do is, like I said before, is we check and make sure how are they appearing, how are they acting. So let's pretend this is a baby that we're taking care of. So baby is unresponsive, so what you can do is pinch the foot, shake it, see if you get a response at all. No response, okay? Also notice the baby is pale. So therefore, I know that this baby's in trouble. So HA teaches if you're not with the patient and then you come and you find them this way, you go ahead and start CPR for 2 minutes and then go call and ask for help. If this happens right in front of you, then you just need to call right away. So the first thing you want to do is get them on a nice hard surface or a surface that you have room to work with. All right, so that we've already established the baby is not active and is unresponsive. So therefore what you do, so you find the nipple line. There's 2 different methods you can use. You can use 2 fingers right dead in the center of the chest, and then you can use 2 fingers to do your compressions, or if you want to, you can actually use your 2 thumbs. The biggest thing is when you do this, I always put my hands right here on this side and use my thumbs and push in. You're not squeezing the baby though. Keep your hands straight and thumbs just go down, okay? When you're doing compressions on the child, you want to do 1/3 depth of the chest, and you want to make sure that there is proper recoil coming back up. This will let you know that you are doing the proper depth and the heart is being able to contract and then release the blood that's in. And once you get that going, you need to still do it at proper rate, is 100 to 120 beats per minute. So therefore, we're going to be at 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So after 30 compressions, then you would do 2 breaths. The only thing that is going to be different is the fact of, so let's say the baby is not completely unresponsive or unconscious at the time, and I notice that they are choking. So with a child choking, what you would do is you hold the baby up, all right? You put your fingers across the mouth, that way you have an opening. You do not want to block this airway. If you notice that they're choking, you sit them on the back and you do 5 back blows. And then you flip over and you do 5 chest compressions. and you go right back to the back blows, okay? So with the back blows, you're hitting the back and then pushing down as you go, all right? This will help try to dislodge anything that might be up top. Like I said, the airway obstruction is the leading cause for an infant going into cardiac arrest. Once that child is completely unresponsive, you would just go back to doing just the normal CPR, which is going to be 30 compressions versus 2 breaths. Now, the only time this might change is if now somebody else comes to assist. So if somebody else is here to assist, then the ratio would change to 15 to 2. If that's the case, then one person can utilize just doing the compressions while the other person is just utilizing the airway. This way they're making sure that they have the one job. They have to make sure that the child is getting the appropriate air. And when the air goes in, you want to make sure that you get that chest rise, because that's going to let you know that they are receiving the breath. Now, one thing you'll find out too with pediatrics are the babies have bigger heads with the smaller torsos. So sometimes if you don't have the appropriate head tilt, chin lift, you're not going to get that air to go through. And I can demonstrate that right now. So right here, the chest didn't rise at all because the baby's head is pushed forward, and therefore he clamps off his airway. I tilt the head back, and then I get nice chest air rise. And what this does is it helps it to make sure that it has a clean path. The appropriate way to do a breath is you want to always do a head tilt, chin lift. So right under the chin, you can use 2 fingers, and then I always put my hand just on the forehead, and I'm pushing up on the chin and helping it back. All right, and then once that's in place, I have my mask, or if you're doing mouth to mouth, and then that way I can just deliver the breath. And to know that you're getting the appropriate breath in, all you're looking for is that chest rise. Once you get the chest rise, you stop, and then you set for a second, and then you start the next breath. One thing with the child's airway is a child's airway will actually go into a cone shape versus an adult that is just a straight tube. So therefore, the airway can get cut off. And one other thing that you can do, especially if this is happening at home, the good thing is nowadays everyone has a cell phone. So it's no longer you having to go run to a telephone to go call 911. So when you do have a cell phone, that's great. Call 911 on a cell phone, lay it down, put the speakerphone on. That way you can talk to 911 as you're doing the chest compressions or the CPR for this child. The other good thing is too is they will become your coach. They will help you and assist you in any way that they can, whether it be they're listening the whole time to hear your compressions, and so they'll be able to tell you you're going too slow, you're going too fast. They'll be your coach. They'll be a lot of help and a crutch to you in this time of need. All right, well that wraps up our training today for the infant CPR. Now please make sure to know if you need any questions answered, you can either contact us at Richmond Ambulance Authority or American Heart Association. There's plenty of resources out there and plenty of people would be more than happy to help you any way we can. Y'all have a good day.